Welcome to this educational recording on the topic of applying the model for improvement to fall risk screening. The Catch-All Falls program is supported by the Nebraska Department of Health and Human Services Office of Rural Health through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch-All Falls program is led by myself, Vicki Kennel, and my colleague Dawn Venema. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement and organizational science. Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this recording are to describe the model for improvement, create an aim statement to guide your fall risk screening improvement efforts, establish outcome, process, and/or balancing measures for your fall risk screening improvement efforts, and finally, to identify specific changes to test to improve fall risk screening practices in your clinic. The model for improvement was developed by Associates in Process Improvement and is the improvement model that is widely promoted by the Institute for Healthcare Improvement. The model for improvement is based on 3 fundamental questions that can be addressed in any order, though we typically need to answer the first question first to set the direction for our work. First, what are we trying to accomplish? This entails generating an understanding of the problem or issue that we want to improve, in this specific case as it relates to fall risk screening, and setting an aim or a goal for improvement. Second, how will we know that a change is an improvement? This requires identifying the data and the measures that we need to gather to help us understand if the changes we implement actually lead to improvement. Third is what change can we make that will result in improvement? While all improvement requires change, not all changes are going to necessarily lead to improvement. We need to identify and select changes that we anticipate will address the problem and help us achieve our aim. We will discuss each of these 3 questions in further detail in this presentation and discuss them in the context of fall risk screening. The Plan, Do, Study, Act cycle will be covered in detail in a separate presentation. Once a specific problem or issue that you want to address has been identified, so in this case, as it relates to fall risk screening, your team can establish an aim statement to guide your improvement efforts. An aim statement is a clear summary statement of what your team hopes to achieve in a measurable way over a specific amount of time, including the magnitude of the change that you hope to achieve. This statement will serve as an overarching guide for your work, and importantly, establishes what success looks like for your improvement efforts. A clear aim statement can help to keep the project on track, provides guidance on the processes to explore, the measures and metrics we should identify, and where to focus our efforts. To help you with creation of an aim statement for your fall risk screening improvement efforts, we wanted to share with you a couple of example formulas for drafting an aim statement. The first is to improve your process or problem from some sort of baseline measure percent to some sort of target percent by or over some sort of time frame among your specific population by doing whatever your intended changes are. Another example is to increase or decrease something, some sort of process or outcome from some sort of baseline percent, rate, number, etc., to whatever your goal or your target percent, rate, percentage, etc. is by or over the date or specific time frame in, again, the population impacted by doing whatever changes you have planned. You might consider adding that last component, the what, like the what changes you intend to make to help you achieve this aim at a later time if those aren't yet finalized or thought about at the time of setting the aim. And these things will certainly change over time as your work evolves. We've created an example aim statement for fall risk screening for reference as you create your own aim statement for your fall risk screening improvement efforts. For example, an example fall risk screening aim statement might be something like to increase fall risk screening completion rates from 50% to 90% over the next 6 months for all adult patients ages 65 and older who visit the clinic. Next, to help us answer the question, how will we know that a change is an improvement? We need to identify the data and the measures that we want to gather to help us understand if the changes we implement to try to address the problem or the issue that we hope to address actually lead to improvement. Measures for improvement efforts often fall into one of three categories: outcome, process, and balancing measures. Outcome measures are the measures that we typically focus on or think about first. Almost all improvement activities will include at least one or more outcome measures. Outcome measures are those that help us indicate how our system is performing. So essentially the overall result or impact on our patients, our employees, or other relevant stakeholders. An example outcome measure for a fall risk screening improvement project might be the percent of older adult patients ages 65 and older eligible for a fall risk screening with a completed fall risk screening documented in their medical record. Process measures are often logically connected with the outcome measures. So with process measures, these measures typically show improvement before we see improvement in the outcome measure. With this in mind, process measures often serve as an early indicator of whether or not our changes are perhaps resulting in improvement. Process measures help us to understand if the parts or steps in the system are performing as we planned or intended them to. An example process measure for a fall risk screening improvement project might be the percent of adult patients ages 65 and older who were eligible for a fall risk screening that were actually offered the screening. Process measures are very valuable measures as we work to test changes. It can sometimes be easy and tempting to want to collect a lot of process measures. So you just want to think carefully about the measures that you really need to help you start to see if your changes are in fact resulting in improvement. Finally, we often look at balancing measures. One way to think about balancing measures is that they can help us to detect unintended consequences of the change that we made, for better or for worse, or they can help us to track events that might serve as an alternative explanation for the improvement. In other words, we may see changes in our outcome, but they could be explained by something other than the change that we actually made. An example balancing measure for a fall risk screening improvement project might be the average length of time it takes to get screening results from the patient to a provider for use in the appointment. Some key things to keep in mind as you develop measures for your improvements efforts is to provide a clear name for the measure, a clear operational definition of the measure, and to identify who will collect this data and how often it will be collected. Finally, to help us answer the question, what change can we make that will result in improvement, we need to identify and select changes that we anticipate will address the problem and help us to achieve our aim. Often the changes that we need to make for improvement are relatively clear and straightforward. For example, in the context of fall risk screening, perhaps you need to select a screening tool, want to change your screening tool, want to change the process that you use to administer a fall risk screening, or improve your patient education about fall risk screening. But many of our improvement efforts are complex, and more than one change might be needed to help us address the problem. Change concepts can be helpful guides here. A change concept is a general notion or approach to change that has been found to be useful in developing specific ideas for improvement. These categories can be helpful to think about as you formulate a specific change, as they connect your change back to a broader concept that can help to inform the way in which you approach the change. I've highlighted several general change concepts here with specific examples related to fall risk screening, and hopes that this might help to spark some ideas for change to help your clinic improve your fall risk screening efforts. First is to focus on the service. So for example, what fall risk screening tools work well for your patient population? When might you offer a fall risk screen? How do you inform patients about the process? Another is to think about enhancing the patient relationship. What are patients receptive to for fall risk screening, and what is necessary to overcome any resistance? Another may be to manage time. How can you streamline your fall risk screening process? Another may be to manage variation. So how can you standardize your fall risk screening processes so that all eligible patients receive a screening? What efforts can you take to verify the accuracy of screening responses? Another might be to improve the workflow. So when is best on the patient's visit to complete the fall risk screening? How are results shared with the medical staff? When are results documented into the EMR? And finally, you may need to consider changing the work environment. What information, training, resources, or other support is needed to support changes to your fall risk screening process? So in summary, the model for improvement can guide fall risk screening improvement efforts. One thing to think about is to make sure you have a clear aim statement that guides your work to help inform what success looks like for your improvement efforts. Establishing a set of clearly defined measures can help to inform if you achieved your aim, made a difference, and what the impact of your changes may be. And finally, to think carefully about the specific changes that you might want to test to help improve fall risk screening practices in your clinic. Finally, I will leave you with links to several tools that you can download from the Institute for Healthcare Improvement to support developing an aim statement, establishing project measures, and to use change concepts to inform specific change ideas for your fall risk screening improvement efforts. To access these materials, you simply need to visit the link online, and then the IHI asks for your name, your organization, and your email address in order to download the materials. Thank you for viewing this presentation on applying the model for improvement to fall risk screening.